When an artery needs to be replaced, surgeons are usually harvesting structures from another region or using a synthetic graft, and both come with challenges. Harvesting is time-consuming, synthetic grafting can lead to infections and, of course, surgical complications, and sometimes it isn't even an option at all, of course, putting patients at risk. But what if a groundbreaking development in regenerative medicine could change all that, offering hope in critical moments like potential amputations or life-threatening conditions?
I never thought I would walk again after my injury. It was scary.
Devon Barnett is a longshoreman. She was severely injured in an accident at work when a crane pinned her against a van, crushing her knee and ripping through her hamstring and femoral artery. It seemed like an amputation was the only option. She says thankfully she had Dr. Michael Curie on her side.
That night, I ended up going to work and I was a whole man and I had to take off the twist locks on a container box. One of our work vehicles was parked too close to the gantry crane, which is what actually takes the boxes off the ship. I went to go try to stop the crane from moving and hitting the van, and when I did that, the crane hit me instead. With Dr. Curie, with talking to my mother to make sure that they made the right decision for me to be able to use the vessel and not have to think about getting amputation of my leg. So the vessel itself helped save my life, my leg, and be able to live a normal life now.
This vessel that we're talking about is a grown blood vessel. Devon was a patient who enrolled in the trial in which we used it for replacing a segment of her artery, which was damaged when she was in a traumatic incident.
Devon, under Dr. Curie's care, decided to receive Symvess as part of the clinical study. The procedure saved her leg and she made a full recovery.
Well, this is providing us as vascular surgeons a new option for how we treat patients who have arterial injury. When we have to reconstruct someone's artery that's been damaged, typically we use the patient's own vein. And there are times when, for whatever reason, we can't do that. Either the patient doesn't have a suitable vein or there's some other reason why we can't use that vein. Having something that has a resistance to infection, something that acts more like the patient's own body is a game changer.
Joining me now is Dr. Laura Nicholson. She is Humacyte's CEO. I appreciate you being here today, and you brought some show and tell for me, which I love.
I did.
Let's start with this. What is this in front of me?
Well, that's a sample of an engineered artery that Humacyte has grown in our manufacturing plant, and it's a human artery.
Quite dirty. It feels almost plastic. It feels like squid. That's what it feels like.
That's what surgeons tell me. They say it feels like calamari.
So talk to me about how this is manufactured, where the idea came from. I got a million questions. So.
Right. We use human cells, actually, human blood vessel cells in a manufacturing process that we've developed over the last 30 years. And we take the cells and we put them on a scaffold. And that scaffold can be 40 centimeters long and 6 millimeters in diameter. And it sits inside a bag like this.
So you point that out because you have different sizes and lengths.
We can grow different sizes and lengths.
So it's different if I need a popliteal artery bypass or if I need axillary access or something from my groin. And these are all bypass, they're not intra-arterial?
They're not intra-arterial. So this material can be a PAT or a repair conduit. So for example, we've used these vessels to treat wounded soldiers in Ukraine in a humanitarian effort. I think we can grow every vessel in your body except for maybe the aorta.
Of course, I had to go right there.
You had to go right there, but we can do pretty much everything else. We can grow them as small as a millimeter and as large as a centimeter or more. We've treated 600 patients. We've never had an episode of rejection. But what's also cool is that we've seen in every patient we've examined, after this vessel is implanted into a patient, it has no cells of its own, but over time, cells from the patients crawl into the vessel and they turn it into a living artery.
Do they develop an endothelium?
Yes.
That's crazy.
It's crazy.
So the endothelium, the lining of our arteries, is an organ system. It's an organ system. So you literally have your own organ system implanting itself within this matrix.
Yes.
Wow.
Well, we just got approval a few weeks ago for this, our first product, to use this to treat traumatic injury. As I mentioned, we've treated war fighters in Ukraine, and we've treated civilian injuries here in the U.S. We've also, in earlier studies in animals, we've been studying smaller versions of this as a heart bypass.
Oh, goodness.
And we're hoping to perhaps start those clinical trials next year.
So somebody who, say, had an internal mammary that wasn't suitable to movement, you could shunt it with this.
Or there's a lot of patients who don't have vein, either because they've been sclerosed or because they have varicosities or whatever.
Just use this as the venous bypass.
Yeah.
So to learn more about ATEV, which is also known as the SymVess insert, visit symvess.com, SYMVESS.com. There's more to come. We'll be right back.